Audio Jungle. Hello, everyone, and welcome back to The Power of One. I'm your host, Anastasia von Sivers, and today I'm excited to be joined by Dr. Uberto Giovannini, a distinguished plastic surgeon based in Milan, renowned for his precision, artistry, and deeply patient-centered philosophy. Dr. Giovannini brings years of experience to every procedure he performs. In this episode, we'll delve into his journey into plastic surgery, uncover what makes his Milan clinic stand out, and explore the balance between aesthetic vision and ethical practice. So without further ado, let's jump in. Welcome, Dr. Giovannini. Hello, Dr. Uberto Giovannini. Thank you so much for your time.
Thank you, Anastasia, to be here. It's a pleasure to discuss you some hot topic in such hot day in Milano about aesthetic and plastic surgery.
So, and we start with question. Can you tell us a bit more about your journey? What led you to pursue a career in plastic surgery?
Well, this is a long, long run for me. Basically, I was lucky because in my early age, I was survived, and a surgeon made me possible to become a surgeon as well. And for me, the issue of reconstruction was a major point during my medical studies. I really like to fix wrong things and make people feel better. So I start my career in reconstructive surgery, especially was about burn surgery and microsurgery, and then I moved further to breast reconstruction and more cosmetic as well, because when you are doing reconstructive surgery, the challenge is to make things as much natural and beauty as possible. And finally, you realize also that cosmetic surgery is very close to reconstructive surgery, because people are not really with a tumor or car accident, but they have some issue on their body, on their face, but are not corresponding with their inner soul. And the role of a plastic surgeon is to listen to the people, to cook their anatomy, their body, their soul, and fix the harmony between the inner soul and the aesthetic aspect.
Speaking of intimate plastic surgery, purpose and psychology. So intimate plastic surgery is still a sensitive and often misunderstood subject. Why do you think some women and men choose to undergo this procedure?
Okay, so we are really going the hot topic.
Yes, I would like to start
of the lecture.
Hot topic.
You like very hot? But it's really interesting, the evolution of genital surgery as well. It's the same, most of the genital surgery in my early career was about reconstruction after burn or after cancer of the vulvar area. And after I really see evolution, especially in one period I was working in the north of France, and I started to have some patient couples that were coming for intimate surgery. And this type of patient are very libertine life, and they consider also the beauty of the sex a master for them. And they're discussing to have harmony between the man and the female. And further, I think with the year, the evolution of the society, the fact now we have porn, we have pornography, and the aspect of the sexual life is much more open. But in the last century, in the new century, we have much more freedom. Also, we have, this is not a topic I'm doing anymore, but I've done for a while, was also the transgender surgery, bring to have much more performing technique, much more attention on details to make really wonderful this area, but it's the playground of our personality. And of course, people is still shy to discuss about it, so most of the information they get is on the website. And luckily on the website you can have very good information, even with Google or ChatGPT, but also sometimes the information are very wrong. So in the consultation, we start to make clear the point of what we can do, what we can respect, and always focusing on anatomy. For example, when men come to me asking how many centimeters I can get, I say, it's not a question of centimeter. By the way, we are discussing about volume, so we have to speak more about cc than centimeters. And then I explain them also, it's not only about centimeters, it's about function, because if you gain centimeters, but the penis is not getting up anymore, or some difficulty in erection, we are not win-win solution. So really, for example, in my practice, we have really a protocol with study about revascularization, the skin, the cavernosus corpus, checking also about the function in ejaculation, and then really tailoring the surgery to the patient. And concerning the woman, it's the same problem. We have discussion with the woman about what aspect they want to have about their pussy, if they want more like younger or middle, if they want really the labia minor almost not evident, or if they want to enhance a little bit more labia major. It's the same. We are tailoring the surgery. Sometimes also you mix up with regenerative medicine to improve the squirting, to improve the sensation, to treat dryness with laser. So really, it's a puzzle, and you take different pieces, and then when
it's basically a complex.
It's very complex.
If you do one surgery for one woman or for one man, so you count everything.
Yeah.
Size, sensitivity, and in terms of health conditions as well.
And sometimes also I address the patient to a sexologist, because sometimes also the problem is not just down, but also it's in the brain. And sometimes when you fix the problem down, you fix the problem in the brain, but sometimes the opposite.
Yeah.
Sometimes you have to fix the mental before the physics. So, for example, for early ejaculation, sometimes you do some surgery, you do some injection, and you really improve it. And sometimes it is not changing because it's more in the mind. So really, we always have to adapt our indication to the patient, and also balance the risk-benefit. Sometimes surgery, even if nowadays with a modern technique, and the clinic where I work with a higher standard of security, but you still have small percentage of risk. So if you have taken a risk, of course, you have to have an advantage of the risk you are taking.
Mm-hmm. This is, I would say, it's like common misconception about intimate plastic surgery that you mentioned lately. Yes, in the psychological thinking of people as well, because some people, they don't really need the surgery, but they want to come for intimate surgery, they want to change something, but they don't really need it.
Yeah, so most of the men are normal size, but they want bigger.
Sure.
Because in most of the time, I used to also refer to sculpture of Greece and Roman, and I say, you see, in Roman Greece sculpture, the penis was very small, but what makes very, how can say, very male, very virile is the pubis, but has to be flat. So most of the time, the first indication I give to this type of patient is to do liposuction on the pubis, because when you have a flat pubis, you get more virile aspect than have a round pubis that is more feminine. So this is just one issue. The people focus just, I want to have 25 centimeters, but if you have a puffy pubis, even with 25 centimeters, you're not so virile. So also this is something that people, they don't understand, or they don't know this peculiarity, and we have to speak with them about this. And by the way, I modify a little bit my technique in surgery to get even flatter pubis during the surgery. And for women, it's similar, because sometimes we just say, I'll get rid of my labia minor, but say, okay, but labia minor, we cannot cut the way we want. We have to follow anatomy, because if we do wrong cut, and likely happen to me to see patient treated in not correct way, after the clitoris, can we stimulate too much, and this is inconvenient, or even if it's too cut, then you get dryness, because labia minor have also role of protecting. So we go back to anatomy. So we have to check what from anatomy we can remove. Sometimes we have to remove partially the labia minor, and we have to put some fat to enhance labia major, and this gives a new balance. But this is much more following the anatomy, and we don't get any problem in the function, because aesthetic has to respect the function, and surgery has to follow anatomy for the indication.
Yes, also, if we're talking about restorative reasons, let's say for women who have experienced female genital mutilation, so what kind of surgical options are available to help restore function and dignity for women? Okay, and you know, it's very, very big problem.
This is a very big problem. It depends also on the type of mutilation, when it was done, the age of the patient, how much the tissue are destroyed or are just modified. Because if you still have modified tissue, it's a long surgery, but you still manage to restore, put in the place with the tissue that are misplaced. But if you get some mutilation with infection and taking out all the tissue, which is much more longer run, it's really going to be similar. Sometimes it's even worse to the transsexual surgery, because you have to deal with a lot of scar tissue and also psychological trauma. Me, I had patients that are coming, for example, that patients that have been raped, and they ask to restore virginity, just to start a new chapter in their life, and put something that was so shocking. It's so shocking for them, and say, okay, now I want to again have a possibility to have the sexual life that I like. Also, it's not as dramatic as mutilation, but I have after pregnancy, but I've done a big study when I was in France in Montpellier about episiotomy and how much can be painful.
What does it mean, episiotomy?
Episiotomy is when you cut between the vagina and the anus when you have a baby
To have a baby,
enhance the vagina. And sometimes the patient experiences such trauma, they feel so much pain in this scar, but it's not justified by the scar, but it's justified also by psychological impact. And for example, in that type of problem, the regenerative surgery using stem cell and everything bring a very brilliant solution to such a problem. And bring woman to be not just a mother, but being also a woman.
Yeah, and what about men? How can intimate plastic surgery help affect certain diseases? If those diseases kind of affect the intimate life. And
for example, we have Latoroni syndrome that makes the penis being not straight anymore and have painful during the erection. In the early beginning of this pathology, we can treat with fat transfer and platelet transfer to get rid of fibrosis. We know that is a degenerative pathology, so the earlier we treat, the longer we keep the function for the men. But when the pathology really ends up in dramatic situation, in that case, after the only issue is to take out everything and to put an implant. But basically, we know that we can postpone this dramatic effect doing the same regenerative medicine using stem cell from the fat and using stem cells from the blood. And this really is the new trend, the new frontier on regenerative intimate surgery for pathology.
You're actually the first doctor who told me about men intimate surgery, that men also do this.
Yeah.
I would never guess that men also do this, but it's very good to know.
Yeah.
Yeah, very, very good to know. This is the big...
And it's a big taboo also because men, they don't accept when we are on the dressing room, in the gym, but most of the men, they don't want to talk too much about their sexual problem and sexual failure.
Mm-hmm.
So this also...
I usually don't like to talk about doctors, just in general, to go to doctors.
Yeah. And it's always what I say to my patient, you're just always focus on centimeters. But also another major point is the blood that has to come to the penis. And for example, if you're a smoker, the quantity of blood that is arriving is lower, and that means even the erection is not hard as someone that is not smoker in the older age. After, of course, nowadays we have really a turning point with the arrival of Viagra, because Viagra really allowed men of my age and if older to keep having erection and having sexual activity. By the way, I'm lucky because so far I have good genetic and health. So so far I didn't yet need a Viagra for me. But in general, now men on 50 or 60, but they don't have very good hygiene of life, or like they don't have good genetics, they experience the first, failure in erection. And Viagra really haven't that meant to keep erection even in the middle age.
What was the most difficult restorative surgery for men or for women in your experience?
You're talking about reconstructive surgery.
Reconstruction, yes.
Well, for men, I remember I was in France, in Montpellier, and was dramatic because, by the way, I was a young man that has an infection on the penis, so it's a septicemia, and really was risky of life. So we have to take out all the skin and cavernosus corpus, and when we have to reconstruct with skin graft, flaps, and everything to give him back a penis. And he got under 5 or 6 different surgery. And by the way, the first surgery was life-saving surgery because he has got a bacteria that was going to kill a necrosis on our body. So you have to bring very quickly the OR. The technical name is necrotic fasciitis. That means you have a complete necrosis of all the tissue because blood is not coming anymore. So you have to take all the necrotic tissue, and then we do some treatment to improve our vascularization, and then we have to do skin graft with artificial dermis. We have to put fat graft. We have to put flap to reconstruct well without penis. And as I say, I think we go 6 or 7 surgery to reconstruct it. Just from a bacteria that get a small infection from the wound, but this is very aggressive bacteria, and is described starting from very little injury, you get really dramatic outcome.
So
and for woman was about degenerative restriction of the vulvar area, so she get all the vaginal and vulvar area getting shrink. So it's the same. We need to go with regenerative treatment in the beginning, and then open all the scar tissue and put in skin artificial dermis and graft and skin graft for giving a new elasticity on this area. And on the same, we try to reconstruct as much as possible the outside area, putting fat on the labia major, recreating with a local flap the labia minor to give an aspect of as much as possible natural vagina and vulva.
I remember we were talking to you, and I remember you said that in your childhood you liked repair things.
Yeah.
So basically your childhood kind of hobby grown to your
profession.
To your profession.
Yeah.
To your
I really like to, as you say, repair people. For me is really something. You really help people, and the best rewards when patients come and you see that we start a new life, and really they feel balance between their soul and their physical, and now we say now my life is better, and you really give life to my year.
Let's talk about facelifts and the complex aesthetic surgeries.
Yeah.
How do you achieve natural looking results while still making a visible improvement? And if we have some examples before, after.
Correct. On facelift, for me, it's really I can say, I don't really have a favorite, but facelift is something I really enjoy because, as I said in the beginning, I do a lot of reconstructive surgery, and basically the face is what identifies a person.
Mm-hmm.
We use the face, even for the iPhone, you recognize the face. So it's the face that makes us a person, and make our identity. And so I do a lot of research, even my PhD on the reconstruction of the face and everything. And facelift now is, one way, is something I really like to do because you have to study the person, and every facelift is different. We don't have just one facelift. When the patient comes to your consultation, you have to check. First thing, you have to check what is the wish of the patient, which type of improvement he wants on his face, dramatic improvement, elegant improvement, slight improvement. And after, you have to go back and evaluate the patient, evaluate the downtime the patient is ready to have, and also study his anatomy. Studying how is his bone evolution, because the bone we have in our 50s is not the bone we have in our 20s. Checking the muscle, checking the fat. Is the fat just go away, or just is being sliding from one side or the other? What are the tissues that are missing? What are the tissues that are displaced? And after you take all this different information, you discuss with patient. You discuss also how the patient is accepting which type of scar, where to place the scar, which is the scar is acceptable for him, which is a compromise, which is something he, because we have male also, we have facelifting, she or he doesn't want. And you take all this information, you study the patient, and then you perform a surgery. And by the way, the last word also you have inside the surgery, because it happened to me, especially more and more people have done fillers or injection of whatever. And so when you open and you are inside, sometimes you have some surprise. And where was a tissue? In reality, it was not a tissue, it was something, a foreign body part was there. And of course, this is, for me, very useful to have a background in reconstructive surgery, because I'm able to adapt even to the surprise of the OR, and finally ends up with the result that the person want.
What about Mounjaro and Ozempic face?
Yeah, this also
talk about it.
This also it's a new trend, because now, especially after that, Elon Musk say he was losing weight using Mounjaro. All the stars in Hollywood, not all, but many stars in Hollywood coming out about using this drug that helped to have weight loss. But we have two major issues. This already experienced when I was in France working in a clinic that was the regional center for bariatric surgery, and so I had many patients that very quickly weight loss, and the fat that is going away, and this brings a problem because the fat, it's demonized, especially in the first 10 years of the new millennium. Everybody was fighting fat. And now in plastic surgery, we know that fat is very good tissue, healthy fat, because the real point is your fat healthy or not? If you do good sport, if you eat well, not processed food and everything, your fat is very good. It's thick. You don't get even you get very low cellulitis, and fat is preventing even aging. And when you do Ozempic, your fat is going away, and so you lose all fat. So you lose fat, and you and you lose also muscle, because we see also in Kobe beef, but it's very delicious. But what you have muscle and fat, because fat gave elasticity to the muscle. When you lose the fat, your muscle get like crispy, and when you do facelift and you suture this mass, the muscle of the face, they are cracking. So make facelift even more difficult. By the way, we were discussing with colleague when we do the training about this issue, and now for me, for example, I'm doing the dissection with ultrasound for the muscle, especially in Ozempic, because in that way you are able to respect much more the muscle that is more fragile but classic muscle.
Speaking of fat, body fat, you also do high definition liposuction. What is the difference with just traditional liposuction and high definition? Because you also do kind of definition liposuction.
Well, we can compare high definition liposuction from Motorola, that was classical liposuction, and the iPhone is high definition liposuction. That means always the same. We go back to anatomy. And my colleague and my friend who teach me the high definition liposuction explain me that you have different level of fat and you have to do liposuction level by level. So how it ends up, you have to do much more infiltration, but classic liposuction. You have to use energy device to melt the fat, and then you have to use...
So you can do it with device without with surgery?
No, it's under surgery, but it's multi-step procedure. While classic liposuction, you just do infiltration and aspiration. With high definition liposuction, you do study of the fat, of the level of fat, deep, medial, and superficial fat. You evaluate the skin, then you use the device, but the device are during in your operation. You are going to destroy the fat, melting the fat. As you take out the fat and you keep the fat. Because after, when you handle the procedure,
you remove all the fat, or you keep this good fat and
the
bad fat?
You remove the deep fat and the medial fat. The superficial fat, usually you keep it, except if the quality is very poor, so you try to decrease also the dermal fat.
How can you do the best, which is good fat, good quality of fat, or bad fat?
Mostly of the time,
to do a kind of test from body with needle, or
you can already in the consultation you can already see if already asking the patient if he keep a lot of fluid, but already is a sign that it's a fat that is poor vascularized, so the quality is not so great. After,
do you have a good fat or bad fat?
Yeah, I think your fat is quite good, because you can see someone that is doing good activity, globally having good food, healthy food, not too much processed food. So especially even with hot days, if your fat is not good quality,
Hot days,
the fat show is his side. When you have good fat, it helps you also in how can I say, the good fat helps you to stand a high temperature. Bad fat made you sweat so much, because keep with water and then throw out the water.
I was working here 20 minutes under the heat, 33 degrees. I didn't sweat much, just in the end, a little bit.
Because the fat is working on this change of temperature from inner body, outside body, but it has to be good.
So this is for advice for people. How can you...
And you saw obese people have problem with respiration, because the regulation of temperature from inner body, outside body is compromised because of quality of fat. Because the fat is too big, and in the ratio between vascularization and fat is bad. And this is, and by way, you see even after the bariatric surgery, the quality of fat stay bad quality. In fact, the color of fat is more pure, is more whitening, while the good fat is more yellow-orange fat.
Is HD lipo just about aesthetics, or can it also benefit people recovering from major weight loss or other body changes?
Not for major weight loss. For major weight loss, it's a different issue. You have really to study the elasticity in the skin, because sometimes that is compromised. So maybe you need some tightening, or maybe sometimes you need even excision of the skin in surgery. What is very useful for high definition liposuction, on the contrary, is people that suffer of lipoedema, but it's a fat, but it's also keeping the water, and this with the device you manage to sculpt much better fat. And also what we were saying, the other interesting thing of high definition liposuction, that you keep the fat and sometimes you filter it and then you reinject the fat to give definition, for example, of the muscle. For example, in gynecomastia, you can inject the fat in the pectoralis major muscle to enhance and that have the muscle bigger, make the torso remain more masculine.
Let's talk about ethics, beauty, and the future of plastic surgery. How do you help patients who may have unrealistic expectations about what surgery can achieve? How do you explain for example, a very beautiful woman comes to you and say, I want to do facelifts, I want to do lips, I want to do this. How do you deal with patients like this?
No.
Or maybe they don't really need this kind of surgery, they need something different, or maybe they don't want anything.
Yeah.
So how do you deal with them?
Well, this is
expectations?
This is a very good question. It happened to me very recently. A patient, but was in her middle 30s, and she came to me because after she was going to traveling, she see her family that was abroad, and she came here to my consultation, and she said, I want to take out the fat of the juvéectomy because she doesn't like it. And I tell her, this is not indication for you. She has a fracture of the zygomatic fat, and say, if I take out the fat from here, all the fat and zygomatic.
Baby face.
Yeah.
If I'm not mistaken.
Will need rate. Well, mostly is to have
More
triangle face. And and after she was still disappointed, she asked, well, please do something to me and everything. Saying, no, the only indication for you is to do mid-facelift. And all the other options are not a good option because anatomy of your face needs that one. And otherwise, keep your money and have a good dinner with your boyfriend. At least have a smile in your face. Even this is a sort of beauty. Because also, I make a joke with my anesthesiologist and say, but aesthetic surgery is the surgical branch of psychiatrist. So we have to make people happy. But if we cannot make them happy with our surgery, we can always give a suggestion to them how to be happy.
Yes, sure.
Because it's question of happiness that way.
Yeah, looking to the future, what advances in plastic surgery are you most excited about, especially in the realm of intimate and reconstructive procedures?
Well, for me, there are three different impacts. One is the regenerative medicine, but we're just in the beginning of regeneration. And this is the meat of plastic surgery is the salamander. It's the animal that is capable to regenerate everything. So this, for us, in plastic surgery, is really the gold standard, is to be able to have a regeneration of a tissue and avoiding hindering and anything is missing, you are capable to recreate it. After that, this is going on a little bit in the same way is the impact of IT, because in that way, as we say, maybe we can better protocolize the algorithm. As I say, you see, we have different things to think about in the patient, and maybe can help us to give the algorithm to the patient about what is good and what is not good for them. And the last for me, it's the re-elaboration of the image, because so far this is more tricky, it's more, I can say, it's more marketing so far to really be able to have simulation of surgery. Because the simulator, when you make the picture and show how the final result, so far it is not what is really happening in the OR. And that, for me, it's a really major point to be able to have a simulator of surgery. So you can simulate the surgery, so also for teaching of the master, because people can do the surgery before going to surgery, and you can simulate yourself and really decide what is the best for a patient. And I know when I was in Montpellier, there was a bioscience department. And for example, I remember we spent like 2 weeks just we were studying my movement in harvesting the skin graft. So we put me all the sensor on my hand with a dermatome and to see how much power I put, all the movement, everything. And it's such a complex thing. So it's not just sort of Photoshop. And also you have to consider plasticity of a tissue, the nerve, the vessel, and everything. But for me, this will be really changing a simulator of surgery, of plastic surgery.
What about face machines, fillers, and surgery after fillers, after face machines? Would you recommend this face?
Well, face machine, for me, for example, we have a big problem, and this is really health records things in Congress with Morpheus. That was very popularized by some
famous problem.
Yeah, many influencers vulgarize the use of Morpheus on the face and say, "Oh, it's great," and everything. Exactly, for short-term result is great, but in long term it creates fibrosis. That is really opposite of regeneration. It's going to speed
the
aging process because it creates more fibrotic.
Okay, can you do something with fibrosis?
Yeah, you can put stem cells. You can go and try to free a little bit fibrotic. You can do lead laser. These are on the opposite or it's all bodies you can use to try to repair the damage of the fibrotic pattern built by this type of machine.
And fillers, threads, the same situation.
Well, filler, it's interesting because filler, we do a lot of filler, more and more. Even the market of filler is exploding. The problem of filler, but are making something very easy. Everybody can do it. You can have people that they do it themselves. You have even some platforms that are selling filler to people. First of all, we don't even know if they are real filler or are fake filler. Even if they are real, you don't even know the chain of transportation has been respected about temperature and about safety. Also, you have to think why you're using filler. Filler with a good indication is good, but filler cannot do everything. Cannot make puffy face. And also, I think the evolution of the filler will be more on something regenerative, taking your own blood, your own cells, processing and making your filler from your cells. But
and
it'll be much
threads. So I remember I had a little hole here, and we did PRP. We removed it completely. Yes.
The same threads can be a solution, temporary solution, the problem of threads, but you are going to create fibrosis. And basically, fibrosis is not the best thing we can have. Fibrosis is always fibrotic. Fibrosis is synonymous of lack of blood and lack of elasticity. And what you have is blood elasticity.
So yes, I did it 10 years ago. I didn't know the result really, and I didn't see much result, to be honest. But I had this hole, and it was getting like kind of bigger and bigger, and so you removed it. Yeah.
And also with threads, you anyway risk of infection, but it's always underestimated because it's anyway it's a foreign body.
That's cool.
So, well, threads can be used. I have colleagues that are very good in threads, like Thierry Besson in France. But some of my colleagues are really treating threads in a very precise way. By the way, I'm doing sort of thread that is not really thread, but maybe we'll speak this another time. But what I'm saying, to use threads, the learning curve is quite high. And the problem, putting threads is easy, but putting the threads correctly takes long time, long experience.
So, as long as you do all plastic surgeries, all types of plastic surgeries, you shared with me this, what is this?
What is this?
What is this? This is breast implant.
Exactly.
It's very soft.
Yeah, this you can choose different type of gel. This is very soft gel. By the way, this type of gel is what I use when I offer my former girlfriend breast implant. By the way, she still have. Maybe if one day she see the podcast, she'll think about me. And anyway, also, this is the quality of the breast. The implant you can see is very good. And you have an envelope and you have a gel outside.
Yeah.
What I should say to everybody, not only to my
Where is it
girlfriend,
made?
is made in by silicone, and the envelope also is silicone. It's
So where is it made? Where is it
made.
country?
It's depend of the production of a breast implant. You have in Costa Rica, you have in France, you have in Madagascar, you have in Germany, and you have in Brazil.
It's quite big. It's 335. It's like
It's medium size. Bigger, it's more about 400, and small is under 2080. But after yes, after it also you see it depends because it's a projection. You can have larger but flatter, or you can have with smaller diameters higher. So.
what if a woman turns on the side? It also goes like this.
Yeah, and you see this
Not
gel,
stay still,
Yeah.
but goes.
this gel is very soft, so it's acting a little bit like natural breast. And this type of gel is for patients that want very natural result. And sometimes you can also do association with breast implant and fat transfer to do what we call hybrid technique. So you put some fat and you put some breast next to implant.
And you also have. They also have this.
Yeah, this is the idea of a implant. So
Ideal implant
yeah, so
side, so your doctor will know what implant is.
yeah, because after 15 years, even if some implants are life warranty, after 15 years, I suggest to change the implant for different reasons. One reason, you see the gel, but now it's coming up quickly. With time it's staying down. You can have fracture of the gel, and especially after a long time, like 15 years, the envelope gets some droplet of silicone coming outside, and that makes more inflammatory. So if you really want to keep your breast young, you have to change your breast implant every 15 years because you don't do any inflammation on the breast area. Because nowadays we know inflammation is one of the major cause of aging. So you can have breast implant because makes you wonderful breast, but you don't have to keep forever because otherwise your wonderful breast will be aging wonderful breast. And we want to have young, wonderful breast. So we change every 15 years, and it's much more easier from a surgical point of view to change an implant that is not broken from an implant that has been broken.
So, ladies and gentlemen, who wants to look beautiful and young all the time? Dr. Uberto Giovannini. All contacts you can find details under the video. Subscribe, like, and share. Thank you for watching.